remain on vacation. They've now canceled votes for 3 consecutive weeks. And Donald Trump is missing in action. He spent more time on the golf course during the 16 days of this government shutdown than he has talking to Democrats to try to reopen the government. You know, our hardworking federal employees are being asked to work without pay or have been furloughed. And the Republicans apparently could care less at the damage being done to the American people and the damage being done to civil servants who all they want to do is serve the American people. We need to sit down and have bipartisan conversations now. House Republicans should come back to Washington now. Donald Trump needs to re-engage now so we can reopen the government, enact a spending bill that actually meets the needs of the American people, and decisively address, once and for all, the Republican healthcare crisis that is devastating the American people. Questions?
We've maintained that the path forward out of this shutdown is you, Leader Schumer, Leader Cohen, Leader Johnson sitting down with the president to negotiate a deal. With all of these informal talks that are going on, you kind of mentioned you were in. Is that still your posture that the way out of this is leader level talks that occur with the president to come to a deal?
The responsible thing for Donald Trump and House Republican, along with Senate Republican leaders, to do is for them to sit down so we can work this out in a bipartisan way. That's the responsible thing to do. Whenever we found ourselves, unfortunately, in a government shutdown in the past, that's always been the way out. But this group of Republicans who simply want to rubber stamp Donald Trump and haven't been given permission to sit down and have a conversation have adopted this position of my way or the highway. And Democrats have been clear. We're not going to support a partisan Republican spending bill that guts the health care of the American people. This is a major issue for millions of Americans all across the country, and it requires urgent action now. In terms of the informal conversations that are taking place in the Senate, as House Democrats, we've been clear. We will evaluate in good faith any bipartisan proposal that emerges from the Senate, as long as it is designed to accomplish 3 objectives: reopen the government, enact a spending bill that improves the quality of life of the American people, and addresses the Republican health care crisis. Thanks.
In terms of the timeline, obviously the shutdown doesn't look like it's ending anytime soon. You would like some changes made regarding subsidies and economic reform. This kind of law would require perhaps a lot of negotiation. How do you foresee this getting done in a short amount of time? What's up the timeline?
Republicans have had multiple opportunities to extend the Affordable Care Act tax credits throughout the year. And every single time there's been a vote in either the House or the Senate, Republicans have uniformly voted against providing affordable health care to everyday Americans. And they've uniformly opposed extending the Affordable Care Act tax credits. Time has run out. Open enrollment starts on November 1st. Tens of millions of Americans right now are starting to receive notices that their premiums and copays and deductibles are going to go up. In some cases, by hundreds of dollars per month. In other cases, by more than $1,000 a month. Meaning that there are Americans across the country, including in Mike Johnson's home state of Louisiana, that are going to experience increases that could total $20,000 a year. And these are Americans who together in their household make less than $100,000. In fact, more than 90% of the people who receive Affordable Care Act tax credits make around $63,000 a year. This is a cost of living issue that has to be decisively addressed now. Time has run out. And when the Republicans continue to insist that they're willing to sit down and have this discussion, Republicans are the same group of people who have tried to repeal the Affordable Care Act more than 70 times since 2010. The American people know they're not serious about addressing the healthcare crisis that they've created on their own, which is why it needs to be done now and needs to be done in a bipartisan manner with Democrats at the table.
Other things that are going to start happening November 1 are staff assistance.
Hold on. I'll go back to you in a minute. We haven't had a formal conversation at all during the shutdown. And in my view, that's because House Republican leadership hasn't been given permission to talk to Democrats by their boss, Donald Trump. We know that throughout the entire presidency, Republicans in the Congress have chosen to function like lapdogs for the Trump administration, a wholly owned subsidiary of Donald Trump and his administration. Nothing but rubber stamps for Donald Trump's extreme agenda. And so the only conclusion that I can draw as to why we haven't even had a bipartisan discussion about reopening the government is because Donald Trump has ordered Republicans to go radio silent. That is irresponsible. It's not what the American people want. And as Democrats, as Leader Schumer continues to say, as we in the House continue to say, we'll sit down with anyone, anytime, any place, either here at the Capitol or back at the White House, to reopen the government, find a bipartisan path forward, make sure that we support our hardworking federal civil servants, and address the Republican healthcare crisis that's devastating people throughout the country, including in rural America.
Okay, so November 1's also